She ended up with a bat in her mouth, $21,000 in medical bills. A wild rabies story. Imagine this. A simple outing under the stars ends in a shocking encounter, leaving one woman grappling with a staggering $21,000 in medical expenses. Erica Kahn learned two crucial lessons the hard way. The first was her decision to go without health insurance after losing her job. The second mistake came when, startled by a wild bat landing on her face, she reacted instinctively with a scream. This strange incident occurred last August while Erica was on vacation at the picturesque Glen Canyon National Recreation Area in Arizona, enjoying an evening of stargazing. A few bats were flitting about, but they didn't concern her until one of them swooped in and got caught between her camera and her face. In her moment of panic, she screamed loudly, unwittingly allowing part of the bat to enter her mouth. Although she is uncertain about which part it was or the duration, she estimates it was merely a few seconds, although it felt much longer. After the bat flew away, Erica was understandably shaken. She believed she had not been bitten, yet her traveling companion and father, a physician, urged her to seek medical attention promptly and to begin rabies vaccinations as a precaution. With the belief that she would be protected as long as she secured an insurance policy before visiting the hospital, Erica promptly searched online and found a policy the day after her unsettling encounter with the bat. She even confirmed with the insurance company that any services stemming from an accident or a life-threatening situation would indeed be covered. The very next day, she went to a hospital in Flagstaff, Arizona, to initiate the rabies prevention protocol. Over the following fortnight, she continued to receive additional vaccinations across various clinics in Arizona and Massachusetts, and even at a hospital in Colorado. But soon after, the medical bills started flooding in. In terms of medical treatment, Erica was given 4 doses of the rabies vaccine, administered over a 14-day period. Alongside her first vaccination, she received 3 immunoglobulin shots designed to strengthen her body's immune response against the rabies virus. Rabies is primarily contracted through bites or scratches from an infected animal, and experts strongly advise taking precautionary steps in the event of potential exposure, as the disease is typically fatal once symptoms manifest. According to the Centers for Disease Control and Prevention, CDC, rabies treatment has significantly reduced human fatalities from the illness to fewer than 10 annually in the U.S. When Erica received the breakdown of her medical expenses, the total amount she was responsible for came to a staggering $20,749 across the 4 treatment facilities. The bulk of these charges stemmed from the hospital where she received her initial care, costing her $17,079. Which included $15,242 just for the rabies vaccine and immunoglobulin treatments. However, the real shock came when she discovered that her insurance policy did not cover any of her medical expenses. She was baffled when she received a letter detailing the explanation of her benefits, which stated that the required waiting period for this service has not been met. Erica found herself in disbelief. "I thought there must have been a mistake," she expressed, acknowledging her naivety about the whole situation. After being laid off from her role as a biomedical engineer last summer, Erica had the option of maintaining her previous employer's insurance through a COBRA plan at a rate of approximately $650 per month. However, assuming she could manage without insurance while searching for a new job, she decided to take that chance. She also thought that in any emergency, she could quickly obtain a private insurance policy without a problem. Per the guidelines from the Centers for Medicare/Medicaid Services, anyone eligible for COBRA is granted at least 60 days to enroll in the plan. And crucially, if they act in this time frame, the insurance coverage is retroactive, meaning past medical treatment can be covered. Erica, who was still within this window when she encountered the bat, realized later that she did not fully understand this option. The policy she secured after her bat mishap, costing around $311 per month, was from a Florida-based company named Innovative Partners LP. Documentation from KFF Health News indicated that this plan included a waiting period of 30 days, which should not apply to benefits related to an accident or life-threatening situations. In the aftermath of her claims being denied, Erica reached out to the insurance provider to learn how to appeal the decision. She was informed that a doctor needed to file additional paperwork. Although she managed to have a letter signed by a physician at Flagstaff Medical Center and submitted it in March, she struggled to connect with doctors at the other treatment facilities. Confusion ruled her experience. Erica received conflicting information regarding where to send her appeal paperwork. Recently, a representative from Innovative Partners LP informed her that they had not received any of her appeals. In early July, she received additional benefit statements revealing that the insurance company had not reimbursed any of her claims. Notably, Innovative Partners LP did not reply to inquiries about her case. Sabrina Corlett, co-director of the Center on Health Insurance Reforms at Georgetown University, explained that most health policies activate on the first day of the month following enrollment. Insurers have legitimate concerns. They don't want individuals waiting until they're ill to purchase policies, she remarked, explaining that premiums brought in by healthy individuals help offset costs. While the Affordable Care Act, ACA, mandates coverage for pre-existing conditions, it does not obligate insurers to cover injuries incurred shortly before enrolling in coverage, Corlett stated. Upon reviewing Kahn's brief benefits overview, she concluded that the plan appeared to be a limited fixed indemnity plan, which pays set amounts for treatments during specified intervals, regardless of the actual medical expenses incurred. Such plans have existed for years and do not necessarily comply with ACA standards, she noted. Corlett added that even if Kahn had chosen a comprehensive health insurance plan, it is likely that it would not have covered treatment received so immediately after purchase. Emphasizing the seriousness of rabies, Dr. David Schlimm, a travel medicine specialist in Wyoming who has expertise in the disease, mentioned that Erica made the wise choice to seek immediate treatment despite not feeling a bite. The potential for rabies transmission is high since the bat's entry into her mouth exposed her to a direct risk. There's hardly a more direct exposure than that, he remarked. Dr. Schlimm shared that normally, healthy bats do not behave in such a way, making Erica's experience even more alarming, as it could be indicative of the bat's possible illness. Moreover, he pointed out that rabies prevention treatment can be prohibitively expensive in the U.S., especially considering the cost of immunoglobulin derived from vaccinated human plasma. This treatment is often administered within hospital emergency departments, which pile on additional costs. As for Erica, she has since secured employment and health insurance. However, she still faces the burden of the medical bills from her encounter with the bat. Having negotiated the bill from Flagstaff Medical Center down from $706 to $420, she also set up a manageable $10 a month payment plan for the $530 owed for one of her rabies shots from another facility. Erica is determined to keep appealing the denial of coverage for the rest of her bills, which exceed $19,000 in total. A spokesperson for Northern Arizona Healthcare, which encompasses Flagstaff Medical Center, stated that they strive to minimize costs but emphasized that they have limited control over the prices of critical supplies, including expensive drugs like immunoglobulin necessary for rabies treatment, even when these occurrences are infrequent. So what's the takeaway? COBRA Insurance, a program established under the Consolidated Omnibus Budget Reconciliation Act of 1985, can provide a lifeline for individuals who lose their job-based health coverage, allowing them to keep their existing plans temporarily. With a 60-day enrollment window, this insurance can retroactively cover medical expenses incurred during periods of being uninsured. Experts like Corlett caution that Erica's experience highlights the importance of individuals understanding their health insurance options thoroughly. For those losing employer-sponsored coverage, exploring individual plans available through federal or state marketplaces may yield better outcomes, as many applicants qualify for substantial subsidies under the ACA. If you're facing job loss, COBRA should not be your only option, Corlett advises. In hindsight, Erica reflects on her experience with regret, wishing she had opted for insurance coverage right after her layoff. "That is a significant lesson learned through hardship," she remarked. Her unexpected wildlife adventure did not deter her passion for nature. Interestingly, Erica even manages to find humor in the incident. "Now I know what bats taste like, a rather earthy, sweet flavor," she quipped. It's actually quite a funny story, if not for the enormous medical bills that came with it. The ongoing series Bill of the Month, a collaborative effort by KFF Health News and the Washington Post's Well Plus Being, aims to unpack and illuminate the complexities of medical bills. Launched in 2018, this initiative has aided numerous patients in negotiating their medical expenses and has been cited in discussions at state capitals and the White House. Have you encountered any confusing or outrageous medical bills? We'd love to hear your story.